Orbital fractures occur not infrequently after trauma. Sometimes they are isolated, and other times they happen along with other facial fractures. The way we evaluate orbital fractures is slightly different in kids versus adults. In kids, the bones are more flexible, and so sometimes when the floor of the eye socket fractures, it falls down and then snaps back up. And as it snaps up, it can pinch some of the muscle that moves the eyelid down. Now, this is referred to as a white-eyed blowout fracture. It's called white-eyed because sometimes it's very subtle. When you look at the child, there might not be obvious signs of a fracture, but the key on clinical exam is that the child will not be able to look up. Now, if there's any suspicion of a white-eyed blowout fracture, a CT scan is necessary and very helpful at looking for this tiny fracture. And if that is indeed the case, then this is an emergent indication for orbital fracture repair. Now, fortunately, in adults, that doesn't happen as often because the bones are much more brittle, and usually when the floor of the orbit fractures, it stays down. This provides a different kind of problem, though, because now there's a larger space. The bony orbit is like a fixed space house, right? It's got fat and muscles within it, and when you open up the floor of the orbit, you provide space for the fat to expand out, and that can mean that the eyeball sinks back. Now, in the long run, that can be a cosmetic issue. And so, volume, or how much of that orbital fat has left the normal confines of the eye socket, is an important indication for repair of the fracture. That generally means that larger fractures are more likely to be repaired, and smaller fractures oftentimes can be observed because when they're small, not as much fat leaves that predefined space, and the eye is unlikely to sink back to the point where it would be noticeable by the average person. Double vision is a really important thing to talk about when we're considering orbital fractures because many times people have double vision when they have a fracture of the eye socket. But this can be for many, many reasons. Of course, we already discussed that in children, sometimes it's because the actual muscle is pinched, and that is an indication for urgent repair. But in adults, it's unlikely for that floor to come back up, right? It's unlikely for the muscle to be pinched. And so sometimes the double vision is because of swelling or because of bruising or a hematoma within the muscle, or sometimes because of a paralytic component where the muscle got so banged up that it's just not contracting very well. On occasion, some of the fat that falls into the fracture site can get pinched by the edges of the fracture. And so there can still be a component where there's actually a mechanical restriction, but it is less likely in adults. So double vision is not a tremendous indication for fracture repair, in my opinion, unless there is, a mechanical component or restriction to the double vision that you can tease out on exam. Now, in terms of how we repair fractures, again, this is highly individualized and depends on exactly what the fracture looks like and the demographics of the patient, right? A smaller fracture in a younger adult, I would be more likely to repair with an implant that will dissolve because younger patients make better scar tissue. And if you can hold all of the fat, all of the contents of the orbit where you want it for long enough, the body will naturally form scar tissue so that when that implant dissolves, you don't lose the volume, the eye doesn't sink back. And of course, having less hardware in your body, I think in the long run, is preferred. In some cases, though, where the fracture is larger, you need to use a non-absorbable implant. And there's a variety of different materials that we use in fracture surgery. I think the key is that the repair type is customized to the patient, customized to the specific fracture, and that you take all of these things into consideration, especially the orbital volume and recreation of that internal architecture to give the best cosmetic outcome and, of course, the best functional outcome.